Hello everybody, Gloria Jimenez right here. I'm so happy because we're gonna have a dog talk. I have been a dog mom for the past 14 years of my life, and it has been a very, very important task for me. And today I do have a special guest. So please come in, Dr. Jeff Werber.
Hello there.
Thank you so much for coming.
Hello.
Say hi, babies.
Nice enough to see me not in the office.
Right? Thank you so much
Thanks
for
for having
being
me.
here. I really appreciate you having time out of your busy agenda and coming over here and talk to us. It's so hard because being a dog parent, you don't know exactly what to do. You don't have actually guidelines.
Like being a parent for the first time.
Exactly, right? And it happened
You think
to
it's
me.
easy, it's not so easy.
No, it's not. Being a dog mom has been a task. I think the greatest responsibility.
Well, we'll try to make it easy for you.
Right? Jeff, what tips can you give us? Treats.
So one of the things with treats is that it's very important to, first of all, the excitement that a dog has
Yes.
with a treat. You can give a treat this big or this big, and they're going to get the same excitement. So the first thing you do when it comes to treats is give the smallest amount is just fine. Because we love to treat our dogs so much, then we worry about the number one nutritional disease affecting pets, obesity. We overtreat our dogs. And another thing to do is it's very important to teach dogs they have to learn to earn their praise. So if they just randomly get a treat, no, they have to earn it. They have to do something good. So you always, whenever you want to give a treat, always add even a simple thing is to sit or give me a paw, right? Or down, stay, and then give a treat. And make it a big deal. The bigger deal you make it, because what happens is we have something called operant conditioning.
Okay.
We want to always accompany with a treat. Oh, good boy. Good boy, good girl. They get their treat. What happens is pretty soon you don't need the treat.
Yeah, you're
Just saying, oh, you're such a good boy. They're going to get the same satisfaction because they know they pleased you. And what's one thing that we love about our dogs is that they love to please their masters. So I'm a big treat fan of treating, and I think it really helps with training. But you have to use it judiciously. You have to ease up because you don't want a fat dog.
A lot of people abused and giving them treats, and I know quite a few friends that they do that, and they think it's about love, and it's actually not, because they can have obesity, and they can have diabetes as well, right?
Of course, and especially in cats. Cats will get what's called type 2 diabetes. What's interesting is, and it's a statistic that I'm not embarrassed to say, but there's stats are that 75% of dogs that are overweight or obese belong to owners who themselves could lose a few. Now you're in the fitness world, you know that. So you can appreciate this. So it's very hard because a lot of veterinarians have a tough time with a client in the exam room with an obese dog or cat, and they're pretty big themselves, and they feel awkward talking about it. And I don't. I say no. I said it's really good. It leads to all these problems: locomotion, joint locomotion problems, and heart problems, increased incidence of diabetes, increased skin problems, increased cancer, and all these things.
There's a lot of my friends also joke about me. Oh no, you don't want for them to eat. I say you're a model, you're this, you're that. You have to value the weight of your dog as well, because if it's a big dog, it's different. Every dog is of course. It depends on what about size. For example, on mine, that one is Bichon Frise, the other is a Shih Tzu.
Right. So it's a difference of size, it's a difference of breed, and also just metabolism. I mean, I have a lot of cats, as well as a lot of dogs. And one of my cats, the biggest eater, is my smallest cat.
Oh, really?
He piles away during the other ones have 2 meals a day. He keeps bugging me for food, and I tested for hyperthyroidism. He's totally normal. His bloods are perfect. He's perfect. He's got a fast metabolism,
So
you just can't tell. You have to approach each case individually. You can have 2 dogs that are about the same size, and they may eat totally different amounts.
Yes, well, they love to eat, both of them.